further ado, I'll go ahead and hand off to Sandra from VOT ER. Oh,
I will.
sorry, Maria.
Well,
Just seen
I'm
the chat.
all good. I'm gonna go ahead and share screen. So if you all could just let me know when you can see it properly. It should be loading here shortly. Can folks see anything yet?
Like right now, just see the loading screen after you selected the present mode.
But it
Okay.
looks like it's trying.
No, it's not done this before. There we go. It looks like my video is being a little slow. So if you all are having any difficulty hearing me, please do let me know, and then we'll find ways to adjust here. But it's really such an honor to be here with all of you. My name is Maria. I know we've already done some introductions in the chat here, but something that I'd love for you all to also share is if you can just share something that you're hoping to learn or gain out of this session, and then Sandra and I will also share introductions for ourselves. And also, if you're just excited to learn everything that we previewed here, then I don't blame you. There's a lot of really interesting topics that we're going to dive into today. I cannot see the chat, but I see that we're excited to learn lots. Wonderful. Okay. All right, so we're just going to go ahead and start off with some introductions, and I will go ahead and kick us off here. So my name is Maria Bobrovsky Artola. I use she, hers pronouns, and I am the Partnerships and Policy Manager with VOT ER. But before coming to my role at VOT ER, I was actually serving my community here in Ohio as a bilingual reproductive health educator. So not necessarily a traditional like clinical role, but a role that, as you know, is really important in bridging that gap between access and resources and information for our community members. As a first-generation Latina who grew up with chronically ill parents, I recognize how important our non-traditional medical roles are. And it's something that I took a lot of pride in and always wanted to make sure I can offer my community members any answers to the questions that they were searching regarding their reproductive health. For me, that work changed a bit in 2022 when I actually started to get an overwhelming amount of messages from my community members in response to the federal Supreme Court decision overturning Roe v. Wade. As a community health educator, I started to get questions about how that was going to impact access to birth control, and I also got a lot of really misleading, confusing questions that were riddled with mis and disinformation. I was distraught at this, and I really wanted to make sure that I was offering my community members access to comprehensive, factual information, and also offer them any of the resources they needed to feel empowered in a moment where there was a lot of uncertainty. So a question that I began to make sure I was asking in my work was, hey, are you registered to vote? Let's double check your voter registration and make sure that you have that power and are able to do it. So now at VOT ER, I partner with all sorts of health organizations and associations to make sure that healthcare workers of all types of professions have those resources to support their communities as well. So that's a little bit about me, and I'm really excited to hand the mic over to Sandra to introduce herself as well.
Thank you so much, Maria, for starting us off. And hello, everyone. My name is Sandra Gutierrez. I am the West Coast Deputy Field Director at VOTR. I am based in Tucson, Arizona. I oversee Arizona, Nevada, New Mexico. So very excited about the possibilities of us working together with the Health Council and seeing how we can collaborate. A little bit about myself. I'm originally from Los Angeles, California. I started my career out there organizing, originally starting with organizing county workers and then just going into all kinds of advocating for a variety of issues from criminal justice reform, public education, really things that I feel all kind of fall under the same umbrella in different ways. When we advocate for these issues in our community, I see that they tend to affect each other. So about a decade ago, my husband actually got transferred to Arizona. So now I call Tucson, Arizona home. And at the time when we first moved out here, I was working as a court clerk. And eventually I started working the Order of Protection desk. So in that time, I was helping victims of domestic violence. And I got a firsthand look at our country's, oh, I'm so sorry. Our country's gun violence epidemic. So it's a very difficult job to speak to victims of domestic violence, but really I found it, I enjoyed the job. I was able to give them resources and opportunities, and that really made me take that experience and want to be part of a greater solution. So I began volunteering locally, and I currently co-lead the Moms Demand Action chapter of Tucson, Arizona. So I think just, as a mother with a young child, I worry about the safety of our kids. And just as a community member, I really want to address gun violence as a public health crisis. So I was at that job and I loved it very much, but unfortunately, COVID happened. And like a lot of working mothers, I had to shift my job and my career. My son has asthma, so I was able to find VOTR, and while I love what I do at VOTR, I don't think that children or families should have their careers uprooted because of health concerns. So I just am grateful that I'm in this position. It allows me to advocate for healthy communities and the way that I've discussed about gun violence and victims of domestic violence. All while also advocating for public policies that impact these social determinants of health. So that's just a little bit about myself, and I will hand it back over to Maria.
Thank you for sharing, Sandra. And just to share a little bit more about VOTR. So VOTR is a 501c3 nonprofit that is strictly nonpartisan, and we are working to integrate civic engagement tools and programs for pretty much every corner of the healthcare and health system. So while VOTR doesn't focus on specific issue areas, we're all coming into this work with a slew of personal experiences that I'm sure you all are bringing with you as well that have shaped the health outcomes of our communities, and something that we can all really garner together in ensuring that we're offering the solution and access to resources through voter registration. So we work with all sorts of healthcare professionals, and I know we have a few folks on the call that we work here that are health equity specialists and public health specialists, and helping to integrate voter registration into their own public health programs and local programs here at the county level in New Mexico. And just to showcase a few of our partners, we have over 700 organizations that consist of hospitals, clinics, medical schools, community health centers, etc. So you name it, we are working to really empower our communities through an inclusive democracy. But I'm going to really get into the bulk of our conversation today, which is overviewing the link between voting and health. And after we give you all some resources on that comprehensive overview, I'm going to pass it over to Sandra to share a little bit more about our VOTR programs and resources so that you can begin to think about how you would like to integrate voter registration into your own practice and community. So there has been a lot said about this concept, the concept of social determinants of health, which I'm sure you're all very familiar with, but it is those underlying community-wide or social conditions that are the causes of poor health in our community. And those are the things that show up in our ERs, in our community health centers, and our other community and social programs. These are things like access to food, someone maybe coming into your office, clinic, or program expressing that they do not have access to housing, access to healthcare, et cetera. But we know that we can't begin to address social determinants of health until we actually begin to address our structural and political determinants of health, things that we like to call the causes of the causes. So like for someone who's living in a community where they cannot get secure housing or a job that actually pays enough to satisfy their eating or their rent, for example, when we zoom back out, it's those social determinants of health that are impacted and influenced by our political, environmental, and other factors actually causing why that rent is so high or why they can't access healthcare. So we know that we cannot begin to address these until we actually go upstream and use a very powerful tool, which is voting. And voting allows our communities to effectively express their voice in advocating for those social determinants and the root causes that lead to poor health outcomes. And there is a lot of problems in access to vote, but one huge problem is that there's actually not enough people at the table to vote. So I would love to see in the chat or some guesses as to how many folks are eligible voters in the US that are actually not registered to vote. I'm seeing some C, I'm seeing D. You all actually pretty much nailed it. It is 51 million folks that are, oh, I don't think my slide went. 51 million folks are eligible voters in the US that are not registered to vote. So a big question that we're left with in this statistic is, why is it that so many people are unregistered to vote? And one of those main reasons is actually because those folks have not been asked to register to vote. You would be surprised to find out that it's over 60% of unregistered eligible voters have not been asked. And it's usually because the common context in which folks are asked to register to vote is at places like motor vehicle agencies, some social service agencies, but not everybody in our country is able to drive or needs to be going to the DMV. Not everybody has a license in that way. So just imagine how these voter registration numbers would change if we integrated voter registration services in all of our health settings, healthcare spaces. We know that this number would shift dramatically. And it's important because we know that the demographic overlap is very stark. It's those same folks that are unregistered eligible voters that are also most marginalized by our current health system. So it's our young, low income, and people of color who are our most vulnerable communities who do not go out and vote. And this same can be said for our 574 federally recognized American Indian and Alaska Native tribes. To no fault of their own, our Native communities face extraordinary hurdles in participating in our elections. And that's why as health councils and community leaders, you can play an especially impactful role ensuring our Native communities have access to the ballot box. It's of our approximately 4.7 million Alaska Natives and American Indians in this country, that 66% are only 66% are registered to vote. So there's over 1 million voters that are not casting their ballots because of a lot of these barriers. And this is a problem because when our communities don't vote, not only are their voices not being heard on local issues, state issues, or federal issues, campaigns are actually less likely to address their needs because they will label folks who do not turn out to vote as unlikely voters. And it turns into this really horrible cycle where folks who are labeled as unlikely voters won't get contact from campaigns, and then it'll proceed in a fashion where folks feel less and less inclined to actually engage with the system that's not addressing them or paying attention to them. And also, who votes substantially affects how our governments raise and spend their money. So when fewer people turn out, presumably more skewed by race, income, and other factors, governments also behave differently when that turnout is high and how they spend their money. And in fact, expanded turnout could increase to that money being going to redistributive programs by an estimated 1/3. So health services, education, public housing, welfare, all of those issues that we named in our social determinants of health. And we can break that cycle by using voter registration as an intervention so that when folks do vote, they're labeled as likely voters, and our government officials are more likely to interact and help our communities feel supported in making their voices heard. But it's not just the communities that we serve that are less likely to be registered to vote and less likely to turn out to vote. It is also our health professionals. In fact, our enrollment navigators, nurses, public health professionals, physicians are about 12 to 20% less likely to vote than our general population. So as we reflect on this, it's important to know that your voice and our voices at the table is extremely important in making sure that we're representing the needs of our community, just as you do every day in your day-to-day roles as public health and health equity experts. This is another crucial piece that you should be integrating into your own toolbox. And our friends at Healthy Democracy, Healthy People help paint the picture between the relationship of our health outcomes and our voting access a little bit more clearly with this health and democracy index. So this index, it's something that if you Google in your own time, you can honestly get lost in all of the relationships, lost in a good way because it's laid out very nicely, but you can get lost in all of the ways in which our voting access actually impacts our health outcomes. So there are 12 public health metrics, and you can see overall the relationship that is painted here between better health outcomes and better voting access. And we can take a closer look here at where New Mexico falls. And we can see that New Mexico here has some lower voter turnout that also leads to lower overall health outcomes. So here, it's our metric of voter turnout. And then New Mexico falls in a very similar place in this trend when we look at overall health outcomes. And this trend is consistent as well for things like infant mortality, self-rated health, mental health, community, family safety, poverty, income, and more. And if we zoom even closer at the counties in which you serve, we can see how these findings impact our communities that have a lower access to civic infrastructure. So we can see here like San Juan, Otero, Union, these counties had especially low voter turnout rates, and they have also less voting access in New Mexico. So later when we share these slides, we have fuller links if you wish to explore a little bit more on a county by county basis. But beyond these overall impacts on voting and relationship between voting and health access, there are also some really interesting studies that indicate the direct benefits or the direct impacts of voting on health. For example, this study in Public Health Review from a few years back demonstrated that even when controlled for factors like income inequality or state median household income, people are more likely to actually self-report fair or poor health in states where there's a below average voter turnout. So in states where we see a lower voter turnout, folks are actually self-reporting lower health. There's also some really interesting child development studies that show that voting amongst adolescents is also associated with less risky health-related behaviors and fewer depressive symptoms in young adulthood. Another study here also just demonstrates this broader link, and it included 44 different countries that participated in that study that also showcase that link between better self-reported health when there are stronger civic infrastructures. And we can attribute this a lot to the benefit of social connections and being in community to express your voice on local issues. And it's with a groundswell of support that also the largest medical association in the US, the American Medical Association, recognizes this link that voting is a social determinant of health. And even in this past year alone, the American Medical Association passed a record-breaking number of resolutions that call for an increased physician and health professional-based engagement in voter registration and civic health. So this includes voter protections for folks before, during, and after incarceration, supporting the health of our democratic systems at large, and also increasing Native American voting rights. And the recognition isn't novel. As I said, this is the continuation of years and years of work and advocacy from all places in our healthcare system. And more recently, we are really excited to share that Native Health, a partner that we worked really closely with during the last election cycle, is now one of the first official National Voter Registration Act designated voter registration sites. And as I mentioned, we proudly partner with some folks here on this call doing incredible work. I'll shout out Kayla and Holly, who are always, it seems, in wonderful spaces sharing about the link between voting and health and supporting community members even in Otero to do voter registration work. So now that I've given you this overview on our link between voting and health, I am going to pass the mic again to my colleague Sandra to talk a little bit more about how VOTR helps to fill this gap in voter registration outreach and to start thinking about ways that we can partner with all of you.
Thank you so much, Maria, for that rich background. And I'm so excited to discuss not only the ways that we help, but talk about some of the tools we offer, resources, and like Maria said, how to get those into your hands so that we can start engaging some of the communities that you all serve. So together with health professionals, we uplift our patient voices by shaping local, state, and federal health policies through the power of their vote. So we really educate patients on just how important their vote is. And we do this by offering tools and programs that we integrate into waiting rooms, discharge paperwork, our staff and doctors wear badges and lanyards that I will discuss in a couple minutes with you. But all of this is really to just start these conversations about voting and get patients to think about the impact of their vote. So we know that 83% of adults will visit a health space in the next year. So research shows that voter registration and turnout, especially in local elections, has a direct impact on health and public investment in health. So this is where we come in. And as healthcare professionals, we have a special position in the United States health because healthcare professionals are seen as trusted messengers. If you look at this slide here, they are among the highest type of profession that patients or voters deem as trustworthy. And for the whole health and well-being of our patients, it's important that we use this trust to better elevate their patients through voting. So we know that patient wellness is influenced by a lot of environmental and social economic factors outside of medical care. So uplifting the ability to reshape these factors through the ballot box is just exactly how we want to serve their health. So, let me see here. I'm sorry, Maria, I'm just making sure that I follow along, and then I'll let you know if you can move to the next slide, please. Thank you so much for the technical assistance. Very much appreciated. So, we're all familiar with the way that DMVs are equipped to register patients to vote, right? So one of the things that we ask is, why can't we do that in hospitals and clinics? Voter registration belongs in hospitals just as much as a DMV. Americans often have more regular interactions with healthcare providers than the DMV. So bringing voter registration into hospitals is an important touch point. And VOTR platforms ensures that providers remain nonpartisan and confidential and confident when helping patients register to vote. An example I like to give is, if we think about maybe someone who has limited income or is disabled, they might not have all of the finances to, take the bus to the DMV. But they do have to go see their doctor, or they do have to go refill their medication. So what we're doing here is eliminating a barrier for patients like that. Patients who just simply don't have access. We're just we're making it easier and accessible for someone who might not necessarily have the means to make it to the DMV. And when we think about the populations that aren't voting, it's often these communities that we leave out, disabled or low income, just because simply it might not be on our radar, or we might not be thinking about it. So just like I said, voter registration absolutely belongs in hospitals and clinics. Next slide, please, Maria. And we know that there are already indicators of success when it comes to voter registration. So if we do outreach to lower income clients, we see that when a nonprofit institution reaches out to them, they actually have the largest turnout. They come out to vote. So again, it's all about reaching these populations that normally are left out of the conversation. And as Maria mentioned earlier, simply a lot of times they're just not asked if they're registered to vote. They're often overlooked. Next slide. We're going to go over a few factors here. So income being one of them, race being another promising indicator of success, whether or not they will come out to vote. So age as well. We see that when clients with patients who are younger, if these nonprofit institutions are doing outreach to them, then they will come out and turn out. So again, a lot of times it just comes back to the fact that they're just not being considered. I've also seen research that shows that younger people actually, they favor that personal interaction, right? Of course, things like voting by mail are great resources and tools, but we've actually seen that younger voters actually appreciate when nonprofits or organizations are doing outreach to them on a personal level. So I think, it just comes back to like seeing value in people that are normally left out of the conversation. Next slide, please, Maria. Okay, and so I am very excited to talk about how we actually go ahead about registering some of these patients and populations that are normally left out of the conversation. I pointed at my lanyard earlier. So what we want to do here is make sure we understand that as healthcare professionals, you all are very busy and your staff has a lot to do every day. So our tools are meant to be quick, non-disruptive. They are meant to flow with just like when you check in with a doctor and you're going over a medical history, it's as simple as asking just a few questions. Do you drink? Do you smoke? Are you registered to vote? Are you safe at home? And it's really just a matter of scanning a QR code. And then the patient does everything independently on their own. So medical staff, doctors, healthcare workers, they're really, again, just providing an easy opportunity for patients to register. They do everything independently on their phone. And again, it's just as simple as a QR code. Next slide, please. Okay. And so some of the, I mentioned the badges and lanyards, but another great resource that we offer are custom digital materials. So this is the option to have flyers, digital signage in your waiting room. And what we've seen and feedback we've gotten from some healthcare centers, hospitals that are already using some of these resources is it really makes an impact when a voter actually sees these QR code, or they have, if they are already, it's already on their radar, right? So a patient might be in a waiting room and see the QR code, think about voting or if they're registered or not. And then by the time they see their doctor, they've seen a flyer, a digital poster. So they're already thinking about it, and they might be more likely to engage. We really want to make sure that we're asking patients several times if they're registered to vote. We know that actually makes a big impact and a difference in whether or not they will register. And again, the more likely they are to register than by some of these trusted nonprofits or doctors, then the more likely they are actually going to come out and vote. So next slide, please. So VOTR offers a variety of programs. We provide funding, education, free resources, and most of all, there are ways for healthcare professionals to dive deeper into integrating civic engagement into healthcare. Right now, we are currently recruiting for our Healthy Democracy campaign. So we outreach to medical students and staff or teachers who we have a competition, nationwide competition. So medical students are actually engaging students on campus, registering them to vote. And at the end of the competition, we have a golden ballot box. But also our founder, Dr. Alistair, he will write a letter of recommendation. So This is one of the ways that we want to address these issues and barriers. When we think about why some of these communities are being affected, we can talk about, racism in medicine and how are we going to address and break these barriers down by educating and, having these younger medical students come in to address these systematic issues. We're actually in this for the long haul. I know that this is a huge election and it's on everybody's mind, but our tools are meant to be used election after election cycle. This is, again, about educating communities on how they're being impacted. It's not just that they need to show up this one day every 4 years. It's a matter of what is going on in their community, how can they be civically engaged? And again, being those trusted messengers, we want to like bridge that gap. So next slide, please.
Yeah, and I do just want to highlight here in with our other programs, I know that most folks on this call probably don't interact with patients in a hospital setting, but the resources that we have also do support our public health professionals in hosting tabling events during Civic Health Month or other civic holidays like National Voter Registration Day. And we are more than happy to accommodate, like on a case-by-case basis for folks on how these tools can be best suited to equip you and what your role looks like.
Thank you, Maria, for adding that. Yeah, especially, I focused so much on Healthy Democracy Campaign because we're in like the thick of recruiting for that program. But Maria's absolutely right. There are a number of resources available to all kinds of public health professionals to engage communities, and a lot of our resources are free. So definitely, if you feel that this is something that you could benefit from, we would love to engage and help see where we can support you in that, especially with August coming up, and that is Civic Health Month. We really want to drive that message home into our communities about how we can be engaged for the long term. So, and I think okay, awesome. Okay, so now we're going to talk about some of the legal just questions that you might have. The first thing that I want to mention is oftentimes people ask, are we allowed to do this work? And as I mentioned earlier, voting registration belongs in clinics and healthcare spaces just as much as it does in a DMV. With the National Voter Registration Act of 1993, it encourages this type of work as long as it's nonpartisan. So that is something that I really haven't touched on yet, but we all of our messaging is nonpartisan. We don't advocate for any politician or take any position on ballots, on ballot initiatives. What we do is, again, just really trying to create access for people that may have barriers. So something that I really like that VOTR offers is we have these wonderful one-pagers. So if you're at an institution or you're working with clinicians, we offer resources, training about what you are legally allowed to say and what not to say. So we really make the work very easy for you. And again, always offer resources, tools, even training like this one. We are there to just support the community because, again, this is completely legal and it is just creating access for people. So just want to really drive that home that we are a nonpartisan organization, and that is primarily one of our focuses. And with that, now is some really exciting stuff. We're gonna actually ask if everyone can take action today. So if you can, if you would please take out your cell phone. We want to make sure that you all are registered to vote. You can go ahead and scan that QR code. And then I would love it if you can drop an emoji in the chat and let me know if you are registered to vote. If you are not, you have the option to do so right now. I will also mention while you all are checking your status and dropping emojis in the chat, our tools, our QR code is actually used in conjunction. Ooh, yay, I love to see all the registrations. Our QR codes are used with TurboVote. So let's say you have a patient who's visiting from Arizona, and they can go ahead and scan your QR code because it will actually take them to a TurboVote landing page that then the patient can put in. Again, this is all done on their phone. You're not doing anything. They can put in their address, and then that will show them their voter registration status, give them the option to update their voter registration status, and see what is on their ballot in a non-partisan way. So again, we don't tell people who to vote for, how to vote. We just provide those resources for them. So that is really something that I think is great about our tools. You don't have to be in New Mexico or have a specific QR code to be registering patients in New Mexico. You can just offer that tool and resource to everyone, and then they can go ahead and update it in a way that's best for them. And all right, awesome, Holly. Yeah. Absentee ballot is my go-to. Although I will say that when I was younger, my parents immigrated from Mexico, and my mom always went to go vote. It was just something that we did. I always went with her as a young child to the polls, and so I always think that had a big impact on me. But so I make sure now, even if I have my absentee ballot, talk to my son about it, show him my sticker. Who doesn't love your voting sticker, right? So, so happy to see all of you, all the registered comments in the chat. And now, an even bigger action that you can take is if you can order your own badge. If you scan this QR code, you will get a free badge. So then that you can go ahead and start registering patients on your own. You can share this if you'd like to take a picture and share it with some of your colleagues. That would be great as well. Again, our resources, our tools are completely free. So we would love it if you ordered a badge, and really, this is the work, right? It's wonderful to sit here and be in community and discussing how we can all help each other and uplift our patients and communities. But really, it's all about getting people to register. So if you go ahead and scan this QR code or take a picture of it, you can order your free VOTR badge. And can leave it up for a second before we close out here and see if you all have any questions. So we have one more slide, but I want to make sure that everybody has this QR code. Oh, thank you so much.
We'll also be sure to follow up with those links, and then folks can also do it on their own time. So Jerlyn, we can share that with you.
Yeah, thank you, Maria. And then this last QR code, this is some of the digital materials that I was talking about. And one thing I didn't mention yet is that these are customizable. So you will have the VOTR logo along with some of the whether, I don't know if, the Health Council has one logo or if you all have separate ones, but they are customizable, so you can upload any logo that you like, and then that way they're in your community showing that logo, and just having, again, that trust, that trust component that your patients are used to seeing. So these include digital signage, discharge paperwork, and they are also in Spanish and in English. If you need other languages, I believe we can look into that, but currently we offer them in Spanish and English. So with that, I think I will open up the floor to see if you have any questions. And again, just thank you so much for giving Maria and I this space to talk about VOTR and how we can collaborate and work together. Please take note of my email, as well as Maria's. I am the New Mexico organizer, so I am your point of contact at VOTR. Have been so fortunate enough to, as Maria said, work with some of you like Holly and Kayla, who have just been wonderful. And I know that they're really pushing this work forward in New Mexico. So if you have any interest or need support on any of the things that we talked about, please reach out to me. Again, I'm your point of contact. But with that, if you have any questions, stats on, well, I know, Maria, I'm not sure if you saw the question. It says, I'm curious if you have stats on registered voters that do not vote too. I know that in Arizona, it's about a third that are coming out for primary elections. I don't have the exact stat or number, but
Yeah, no, I could share that. So we do have a civic health slide deck that includes a lot more literature on voter turnout, the link between voting and health. So we can make sure to follow up and make sure that you all have access to that. But if you navigate to our VOTR website, you'll find on our resource hub that we have a lot of additional information that you can access, and we can look into that.
Just curious, Sandra, you had mentioned funding opportunities. Could you also elaborate on that for health councils and what that is?
Yeah, so right now, well, this is in the 2024 cycle, this opportunity has actually passed, but what we have is called a community civic engagement program. So we work with federally qualified health centers to provide funding, free resources, so they can actually do some of this work, texting patients, reminding them to vote, being out in the community, tabling. So unfortunately, that cycle has passed for the new year. We will keep you all updated. If there is a federally qualified health center that you believe would benefit from our program, absolutely reach out to us. We can put you in our system and then, notify you when that opportunity becomes, when that grant opportunity becomes available again in the future.
Thank you. Thank you so much. And I don't see any questions in chat at this time, unless someone would like to raise their hand. But thank you so much for this information and giving us a chance to just do our own, our little, having the chance to check our status and using the resources in live. So yeah, we'll be sure to follow up with all of the information and the slide deck for health councils. But thank you so much for the information. And I know Holly from Otero County has been using VOT ER for quite some time. So it's been amazing to see that this has been like successful in another health council.
Yeah. Yeah, Holly is definitely one of our rock stars here at VOTR. We're really grateful for the work that she is doing. And again, just for all of you giving us the space, we're always curious to learn about tribal and Native American communities and how we can you know, uplift these communities and work together. I'm always willing to learn from each other. So grateful for this space. And
Yeah, I also want to go ahead and uplift. So we do have recurring calls for new or returning partners where it's a space that you can collaborate, brainstorm together, and also be offer a little bit more on the resources for institutions specifically. So if you find that you're a part of an institution where we can integrate tools that might be a little different than what we discussed here, we will also talk about you know, additional tools and opportunities for partnerships on those calls. So that's in the chat as well.
Thank you. And I do see Holly's hand.
Oh, yeah, thank you. I just want to say, Maria and Sandra, thank you. And I saw Marcos is here too. So thanks for being here. And then just to add that, as most of you know, you've probably seen Kayla present about this in other spaces too, about how our health council has used and adapted and benefited from the VOT ER resources. And she is always, we both are always willing to present or talk, whether it's one-on-one, like if any of you have any questions and just want to say like, hey, you know, how have you integrated into this into your work as health councils? Kayla has just been amazing in developing resources and things that she uses at outreach for health fairs. And so many different ways, our community health workers in our community, and we haven't made much inroads with the hospital yet, but we've made a lot of inroads with like everybody but the hospital. So we're still working on the hospital side of things, but there's just so many different ways to use the resources as health councils. And yeah, and Kayla's just been amazing at developing resources and materials that are easily adaptable by anybody else too. So she's not here today, so I'm gonna just brag on her a little bit, but I do know for sure that she's always willing to talk about how we've done things as a health council and how VOT ER has helped us. So
thank you, Holly. Yes, we are very, very big fans of Kayla, and anytime that we can brag about her, we welcome that love. And for, you know, I appreciate, Holly, everything that you've talked about, all the leeway that you've made in New Mexico. If any of you think that, you know, there's a route for VOT ER to be in some of your local hospitals, we also offer templates for email outreach. I mean, we really try to make everything as easy and accessible for all of you. So I just want to thank you so much, Holly, for all the work that you all are doing in New Mexico. So
Thank you so much. We've got 2 minutes to 1, and it's been, yeah, very informative and educational. So much appreciation to VOT ER and all the amazing things that you guys are doing nationwide. So yes, we will follow up with health councils with the recording, all of the materials that you sent us, all the links, and also your contact information if there's a health council interested in working with your organization, which like Otero has. So yeah, that concludes today's session. And I will just quickly end with some reminders. For our health councils today, we are having a closed meeting to discuss the ancillary support services. An email that's been sent out, but we just want to be sure that we give clarification and answer any questions. That's from 1 to 1:30. So we're going to close this Zoom and open the Zoom for the next session. And then Monday, if you haven't had a chance to join our Health Council's Legislative Summit, that's happening from 1 to 4 p.m. on Monday. So we'll see you all there and have a great weekend. Thank you for joining us.